In today's episode, we're going over a case study of a rotator cuff repair and a CrossFit coach. So, rotator cuff repairs are one of the most common surgeries out there, right? But I don't think there are very many physical therapists who are actually sharing the nitty gritty of what they do from kind of step one all the way up to step 10, back to return to sport and everything along those lines. What I wanted to do today for you is to give you an inside glimpse into how I rehabilitate folks after rotator cuff repair. So it's going to be a CrossFitter as well as a CrossFit coach. So in today's episode, we're going to be going over an initial diagnosis of what this individual had before going on to get surgery. What was the mechanism of injury? How did they get hurt? What was the actual relevance to rehabilitation, right? Sometimes that mechanism of injury is going to be important for how we rehab. What was the person's prior injury history and how did that reflect into rehabilitation? Who do we decide on in terms of a surgeon? We'll talk a little about the surgery specifics. So what type of rotator cuff tear was it? What was the repair? Was there any concomitant pathology, right? Was there any arthritis or anything else going on inside that thing? What did our early physical therapy care look like? What did it look like as we started to advance over the course of time? How did we discharge? How did we return back to CrossFit over the course of time? We'll go over all that stuff. Welcome to the Fitness Pain-Free Show. This is where we help coaches and physical therapists like yourself get your patients out of pain and back to training. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and a meathead. I have my dream job as a physical therapist, coach, business owner, and educator. And I've been doing this for several decades now. I want to help you reach your goals when it comes to coaching and being a better clinician. Before we really get going, I want to tell you about a free download I have for you that's going to allow you to understand this pathology inside and out. It is a rotator cuff pathology cheat sheet. I will leave a link in the show notes so you can definitely go ahead and download that and get started. We go over evidence-based treatment of the rotator cuff with tendinopathy as well as rotator cuff tears. We go over the prevalence of these injuries. We go over anatomy, mechanisms of injury. We go over the clinical presentation of these. We go over evaluation and diagnosis as well as treatment strategies and also surgical considerations. Who should go on to get surgery after a rotator cuff tear and who shouldn't? So I will leave a link in the show notes. Definitely go download this now for free. This is part 4 on our case study of rotator cuff repair. If you missed part 1, 2, or 3, I'll leave a link in the show notes. Definitely check those out before you continue. Month 6, we're just beefing things up again. So day 1, we start off with a 60-degree incline dumbbell bench. We're going to alternate between sides. Largely, we're just increasing that incline more and more, getting closer to overhead. Now we're doing pull-ups, right? So essentially, it's a band assisted. I want to have a 1-second pause and full hang. I don't think we think about this often as physical therapists, but when I'm doing, let's say, a kipping pull-up, the hardest portion of the movement on my shoulder is hitting that bottom range of motion, right? Because essentially you use your core and lower body to create momentum to get your chin over the bar, and then you drop straight back down at the very bottom portion of that pull-up. So we need to develop a lot of strength and preparation in the bottom part of the pull-up. So when I do pull-ups initially, I like to have a pause in the bottom end range to develop some strength control there, right? On day 1, we also had a barbell bent over row. And lastly, we have a pike position shoulder tap. So we're getting upright. We're starting to put a very similar stress on the spine as handstand walking, on the shoulder as handstand walking, but we're not actually handstand walking yet, right? So we're just being creative about slowly ramping up that stress over the course of time. Day 2, first exercise, a dumbbell seated overhead press. Now, this is our first foray into overhead pressing that we've done in probably about 8 months, right? So it's been a large period of time. We backed away from this, and now we're starting to introduce it at month 6, right? We're also doing a band single arm pull down, and this was basically because Brian did not have access to a cable. And lastly, a modified wall facing handstand push-up, right? So handstand push-ups, obviously a big part of CrossFit. We want to make sure we don't go straight back to handstand push-ups. We modify them. The loads are not that challenging on the shoulder. We're going to build our strength up with dumbbell seated overhead press, and we're starting to get a similar stress through the shoulder by doing a modified wall-facing handstand push-up. As we build more symmetry with the dumbbell overhead press from a strength perspective, we can start to leak in more regular handstand push-ups, right? On day 3, we have wall walks. So think about our progression that we've started with. So we started with a plank position shoulder tap. We worked towards a crawl. Now we're doing a wall walk. So we're just kind of sequentially increasing the stress on the shoulder, working our way back to things like handstand walking, right? Going to superset that with a dumbbell seal row. This day, we also have a landmine barbell single arm row. We're doing a box dip. So essentially, we're going to end range shoulder extension and pressing back out of there. That's pretty challenging motion on the shoulder joint. So I usually incorporate this a little bit later into rehab, right? Usually I like to tolerate push-ups first, and then I do an assisted box dip, and then we can do an unassisted dip. And lastly, we can do ring dips. And after that, muscle ups, right? Because essentially when you catch yourself in the bottom position of a dip and a muscle up, right? We need to have strength and preparation there. And I build that by doing a lot of dip variations and working our way up slowly over the course of time. And the last exercise on day 3 is a dumbbell windmill. Phenomenal exercise. It mimics the same stresses the shoulder takes while snatching, right? So think about the bottom position of overhead squat, the receiving position of a snatch. The shoulder has to be an end range, external rotation, abduction, right? Maybe not end range, external rotation, but pretty dang close, right? And a dumbbell windmill is going to be a very similar stress, but it's less dynamic, a little bit more stable, prepares the shoulder for that movement. At month 6, we also beefed up the rotator cuff program. So essentially, there were 3 days per week of strength and then 3 days per week worth of rotator cuff work, right? And essentially, our sideline external rotation turned into a side plank ER. We're still doing scaption, but we're adding a pulse at the top. The T's are the same. We incorporated Y's now, and we're doing band external rotation, internal rotation at 90 degrees of shoulder abduction with the general goal that we want to try to get more proficient with overhead movements. So we started with rotator cuff exercises that are more elbow at the shoulder, right? Elbow below shoulder level. Then we progress towards elbow above shoulder level. Obviously, that's going to be replicating the stresses on the shoulder with overhead activities. It was at this point, so at month 6, where Brian and I decided that it was okay to return back to CrossFit. Now, I think Brian probably could have gotten back a little bit sooner, but in reality, once you start sending folks back to CrossFit, you're losing control of the stresses you're placing on the shoulder joint. So I think waiting a little bit longer is probably going to be a little bit safer than sending folks back, right? And the other piece is you need to give people some sort of idea about what's okay and what's not okay. And in the early stages after rotator cuff repair, you're going to need some heavy, heavy modifications, all right? What I like to use is a patient specific functional scale. That's basically an outcome measure that's popularized in the physical therapy world. And in terms of the movements I have in my patient specific functional scale, I have a patient specific functional scale that has every single CrossFit movement in the gym, right? And essentially, I go down the list and I try to figure out which movements are okay and which ones aren't okay. And I make modifications for every single movement that I don't think are okay at this point. So when Brian goes back to the gym and some movement shows up, he knows exactly what to do. There's no guesswork. There's no coach there that has to make a decision about what's okay and what's not. We don't put Brian in a weird position where he doesn't know what to do. I tell him exactly what to do. I think that's how you keep your patients the safest. Now, there are a few general principles I use in order to slowly leak exercises back into a CrossFit training environment. I like to make sure that we try the movement first in a physical therapy setting. All right. So, a good example would be, let's say, an overhead press. I don't want the first time that Brian tries an overhead press to be in a CrossFit Metcon. I think that's a really bad idea, right? Let's start this off in a much more controlled environment in physical therapy clinic. I can watch the movement. I can see how it looks, right? I can make modifications if it doesn't feel good, right? Once I've done it for a few weeks and I'm confident that Brian can actually do this in the gym, then I allow Brian to do this in a controlled skill or strength environment. Okay. What I mean by that is that usually in a CrossFit class, you have kind of a skill session, strength session, then you have a Metcon, right? So if overhead press is showing up in the skill session or the strength session, then go for it. We know it's probably going to be safe. We did this already in physical therapy. Now, what I don't want Brian to do is that he just takes that movement and does it in a Metcon environment. I think we're skipping a step there, right? So ideally, I like to have folks try that movement first in physical therapy and then transition over to doing that in a strength or skill environment. And once they've built some competency there, lastly, you can incorporate that movement into more of a Metcon environment, right? And that might be about a 6-week period, right? So you maybe introduce day 1, you introduce overhead press in a physical therapy environment. 2 weeks later, introduce that into a strength and skill environment in the CrossFit gym. And then at week 4, you start to introduce that more in a Metcon environment, right? So it's kind of a slow process, but I think it's a nice, safe one. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym. 4 simple steps to getting your clients out of pain. How to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the fitness pain-free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free Certification. Now, the Fitness Pain-Free Certification is the course, the certification that I wish I had as a new grad, that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. Now, month 7, it was a pretty interesting transition period. Now, what do I mean by that? Well, largely from a physical therapy perspective, as your patients start to get back to their activities, right, and doing more and more of their sport, we actually start doing less and less physical therapy. And one of the reasons why is if your athlete is returning back to their activities or their sports, and you also have a very large and robust physical therapy program, it might end up being too much stress on the given area, right? Like the shoulder. So as Brian was starting to progress more and more into doing training at the CrossFit gym, we started to pull back on some of the rehab exercises. So what you'll see here is the program's actually a little bit smaller in month 7 compared to month 6, right? But the movements we're doing now are a higher level exercise, okay? And I'll show you. So day 1, we're working on jerk recoveries. We're doing dumbbell overhead press, and we're doing pull-ups where we pause at the bottom, okay? So a lot of strict strength. We're working much more on overhead strength and stability at this point, but there's only 3 exercises. Day 2, we have a snatch balance, a dumbbell windmill, and we're doing dips with rings, but we're doing a ring thing dip, which is basically an assisted ring dip. If you don't have access to a ring thing, which I do recommend getting, if you're going through, let's say, some sort of big shoulder surgery, and you're looking for some way to modify your gymnastics ring skills and try to slowly build strength and competency, ring things are phenomenal. But if you don't have it, you can always spot yourself with your feet, right? So if you look at these movements, we're getting very, very close to Olympic weightlifting and gymnastics movements you typically see in a CrossFit training gym. And we only have 2 strength days, right? So it's just a day 1 and a day 2, whereas we had 3 in the past, okay? From a rotator cuff perspective, our rotator cuff exercises are just getting a little bit more challenging, a little bit fancier, and we've added in a Cuban press. So if you've never seen a Cuban press before, it's kind of like the turnover in a snatch. So elbows high and outside and then flipping up. So think about using light dumbbells and going into that scarecrow position, elbows high and outside, and flipping the weights up into external rotation and then right back down again. We're mimicking the turnover position of a barbell snatch, basically, right? And essentially, like I said, we're doing less with physical therapy because Brian is doing more from a training perspective. So that's nice. So here we are at month 8, and you can see we have a similar setup as last month. It's just that now the movements are even more challenging. So on day 1, we're doing push jerks. I like to add a pause at the top position of the lift because we're trying to build competency there, right? Next exercise is dumbbell waiter's walk. So again, building competency at end range shoulder flexion. Then we have a hanging leg raise. And this, in my opinion, was our introduction to more kipping movements. However, Brian was not in a hurry to get back to any sort of kipping movements, and he actually wanted to have some more time to work on his competency and strength with strict pulling movements before he got into more dynamic exercises. So we actually didn't give those movements to him, right? Day 2, Brian's doing a hang snatch. So this is the first time he's doing a hang squat snatch, right? We're pausing in the hole because I think that the hole of the snatch, or the bottom position over a squat, is probably the most challenging position for the shoulder. So I want to establish a little bit of strength and control there, right? So over the course of time, when we do more dynamic snatch variations, we have the control we need in the hardest part of the lift. Second exercise, a dumbbell push press. So we're making our dumbbell press a bit more dynamic. I like controlling that eccentric portion just because I think that's one of the hardest parts about push jerks. So we're developing control there. And lastly, we have a slow hollow arch on the bar. This is our transition back to dynamic kipping work, right? Again, we didn't want to rush this because Brian just didn't have that goal. He wanted to take his time, right? And our rotator cuff program was largely the same. We're doing that 2 days per week. So after month 8, Brian actually transitioned out of physical therapy, right? Because at this point, I was pretty confident that we had kind of taken him to the point where he was comfortable, and I felt he was safe to start to transition back into the gym a little bit more. Usually, this is a shared discussion between myself and the patient. Do they feel prepared? Do you feel like you're able to make those last few jumps, get back into training? Would you like more help or not? And I just largely felt that Brian's smart enough to make that transition back, right? Didn't feel the need to keep him anymore. And he kind of felt the same. He was ready to kind of spread his wings and fly away. Now, I did end up seeing Brian a couple more times in the future, but they were just much more spaced out visits. And largely at month 9 to 12, my guidelines were to slowly ramp up intensity and volume, right? So even though we've kind of run through all the movements from a rehab perspective and slowly integrated that into our CrossFit classes, doesn't mean we should just go nutty in the gym and train at the same intensity that we normally would. We still probably want to slowly ramp back up, right? So over the next 3 months or so, we just slowly ramped up the intensity, the challenge of workouts, all the like, right? We also gave him a little bit more guidance on how to return back to kipping movements. We didn't really have a lot of guidance on how to get back to a muscle up or more advanced handstand walking drills, right? Or more kipping, toes to bar. Future programs, I just gave him a few supplemental activities or exercises getting back to those things, right? I also gave Brian a lot of education on on some ideas of how to stay safe in the future. One big piece of advice was just trying to be careful about training spikes. So one of the things that's great and sometimes terrible about CrossFit is they love variety in their workouts. One issue with all the variety is that 1 week you may have, let's say, 300 overhead press and kipping pull-ups, and the next week you might have 50 overhead press and 20 kipping pull-ups. And the following week you're back up to 300 again, right? So the variety is fun, but the shoulder doesn't always like these huge spikes, right? So having a week that has 1,000,000 reps and the next week has no reps and the following week has a ton of reps, just spiking that volume up and down, we know that's one of those things that influences our risk of injury, right? So what that means is that if you have a week that has a ton of stress, right? Let's say you have a workout that has 10 muscle ups, 50 wall balls, 50, I don't know, kipping pull-ups, and then 50 overhead press, right? I might just tell Brian, let's cut down on the reps of some of these and maybe increase the reps of something else that doesn't stress the shoulder as much, just so you don't have an extremely challenging shoulder workout that day. And the other piece that I think we don't think about enough is that if you have a week that doesn't have enough stress, you probably have to add in that stress if you didn't do it throughout the course of the week. Let's say you just have a training week that has no dumbbell overhead press, has no strict pull-ups, has no Olympic lifts like snatch or jerk work. You probably need to plug a little of that into your program at the end of the week, right? That way we don't have a week that has absolutely nothing and the following week has twice the amount that you had the prior week, right? So we want to avoid those spikes. If there's too much stress in a given week, we dose it down. If there's not enough stress in a given week, we dose it back up again, right? So guys, I have another video that I want you to watch. It's the evidence-based guide to rotator cuff repair surgery. I'm going to leave a link in the show notes as well as a link above my head right here. So go ahead and click on that link if you want to continue the learning. And lastly, I just want to say thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, give me a thumbs up. I'd love to hear your comments and subscribe to the channel. If you're listening to this via podcast, please leave me a positive rating and review. It allows me to continue making great episodes like this in the future. And if you really want to go that extra step and support me further, please consider subscribing to Fitness Pain Free Insiders. It's a comprehensive online library that's going to level you up as a coach or clinician. All you got to do is go to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders online library. There's a trial membership. It's super cheap to sign up. And you'll get some more great learning. If you're interested in any of the references, I'm going to leave the link in the show notes so you can check those out. Thanks so much for watching, and I'll see you on the next one.